Hello, hello, everybody. How are you doing? You'll go ahead and bring Kathy on. All
Hello.
right. All
Hi,
right.
everybody. How are you doing on this Wellness Wednesday? We're having a blast. I made some phone calls, so hopefully people will be popping on with us today because we have a wonderful discussion today, and it's going to be about diabetes, insulin resistance, insulin dependent, and things like that. And type 1 diabetes, type 2 diabetes, and even type 3 diabetes. So you may not be aware of what that is. It's very important that you know. We're going to talk about all that today. And if we have to do another segment of this, we will the following week the following month that Dr. Hollis will be on, we'll just extend it because this information is a lot. It's important and it needs to be dissected. And Dr. Hollis is amazing at dissecting things, and Crystal has some wonderful slides for us to go through. So it may go into a part two, which is okay. All right. So, Crystal, you know that we start off this whole segment with your wonderful testimony as to why we do this, what made you do it, and what we're about.
All right. Well, I'm a holistic health coach and a herb specialist. And, the reason I got into this was because when I was 18, I was actually diagnosed with something called ulcerative colitis, which is very similar to Crohn's disease. It's just like one step down, basically. And I had two flare-ups, once when I was 18 when I was diagnosed, and then once when I was 24. Both times I lost over 30 pounds in a month, very malnutrition, both times hospitalized. The second time was just worse. And I was in the hospital for about 8 days. They talked to me about, doing surgery. They talked to me about being on different medications, chemo even, giving me steroids, giving me too much of steroids in the hospital. No one was monitoring it. And lots of things just happened while I was in the hospital, and I was basically on my deathbed. The doctor said, if I was any older, like in my 50s, I probably wouldn't be here. Because I was in my 20s, I was probably able to bounce back better than someone in their 50s possibly. So that kind of was a little wake up call, obviously. And when I was 18, I did find a naturopathic doctor who helped me on my journey to getting better and things like that. But I didn't really take it seriously. So, when I was 5 years later, I just wasn't taking it seriously, and a lot of stress came on to me, and I had another flare up. And I had a 2-year-old daughter at the time, and I had to make some changes. And so I went to her because really I've tried the things that the doctors recommended. I tried some steroids. I tried, some ulcerative colitis medications, and, they just seemed to make things worse. I was still bleeding internally. I, still had all this inflammation and pain, and still had all the symptoms and even more symptoms because of the side effects of the medications, you name it. And so I went to Dr. Inga, and I said, you know what? I've got to learn everything and anything I can from you. I basically was under her wing for years and just learned right underneath her. And I took it seriously, and my health started to improve. And I started to get rid of the things that, like the doctors told me that I would have for the rest of my life, that there's no cure for ulcerative colitis and all that. And you could possibly get cancer. And, once the time from when you're diagnosed 10 years later, and they want to tell you all this bad news. And that's all I was hearing. I wasn't hearing solutions. So when I got with Inga, Dr. Inga, I listened to what she said. I changed my diet and lifestyle. I took supplements. I tried to manage my stress. And this takes time. This is years of work. I'm eliminating,
Absolutely.
food causing allergy causing foods, things that are cause leaky gut. And this takes time. I'm still eliminating things through my diet, that I think shouldn't be there, and that I can find other alternatives that are healthier. And I'm getting better and better. And here I am now today.
Yeah,
Fast
thank
forward.
God.
I know, fast forward, I'm almost 34 here, coming up in August, and I don't have ulcerative colitis anymore. I beat that with living food, plant food, and plant medicine, and looking at the whole body holistically, not just treating the symptom. We got to the root cause, and from that point on, years ago, when I started doing this and I started getting better and my body was healing, I was like, I've got to share this to the world. Like, I can't keep this in, because there's so many people out there with so much illness, and all we're doing is just putting a Band-Aid on it. and we're living like this all our lives with a sickness that we don't have to live with. And so Kathy and I came together because we believe in the same thing, looking at the body holistically, the whole body, mind, and soul, getting to the root cause, not just treating a symptom, and that's what we came together, is to help people, educate them, and to show them that, there are food medicines and plant medicines out there, and things that we can do that are non-invasive, that are an easy fix, and we can fix our entire health. So we're here. We started Natural Health Hub, and we started Wellness Wednesday, and we just thought that this would be a great way to educate every Wednesday. And we love doing it. We have experts on here, especially one that we really enjoy. We have on every single month, about mid-month. Dr. Hollis, Dr. Scott Hollis. He's one of our favorites, of course. We can't say it enough. And
actually, he's my favorite, very favorite. Because of the way that he teaches. So we might as well just bring him on right now. Dr. Hollis.
Absolutely.
He is with, look at that smile. How could that not be your favorite?
I mean, come on now.
Thank you, Kathy.
You're welcome. I've been with Dr. Hollis for 1 billion years. And it's been a wonderful 1 billion years. And we fight like brothers and sisters, but that's because we love each other so much.
We argue back and forth, but you always win the fight.
I don't. But thank you for that.
Kathy's got that Taurus in her. She's got that strong mind.
So we're going to talk about diabetes today, you guys, because I'm learning so much about my own body through my struggle of all of you know that my main goal is to get off all meds. This week, I took myself off of my pain meds cold turkey.
Wow. That's like, I have to applaud Kathy for this, because everybody understand that there are withdrawals that happen here. There are pains, aches, all kinds of things, feeling like flu-like symptoms, tired, fatigue, stronger muscle pains than you were having even before, because you're taking it, so you're detoxing, So just understand that this is a really hard place to be. And kudos to Kathy, because she did it. I'm proud of her.
Yeah. I was taking it because of inflammation, but guys, inflammation comes because of a lot of different things in the body. And so I'm trying to fix those things and stay off of meds. And I'm getting off of meds. I'm off of my pain meds.
Yay.
I'm not doing them anymore. They weren't, I have to say, they were just a strong Advil. They were just a strong, what are they, Dr. Hollis? It's called diflucanac or something like that.
Yeah.
It's like a real
pharmaceutical version.
Yeah, it's like 4 times stronger than Advil.
Is that a muscle
one
relaxer?
pill is like 800. Yeah.
Right.
And I took those twice a day, every day, for years.
And yet you're in such a good mood, even with the withdrawals. We like this, Kat.
It is what it is. That's how I am. But the other two I want to get off of are my high blood pressure medicines, which is only one. I only take it twice a day. Well, I've been taking it once a day. I should take it twice a day. And my diabetes medicine. I want to get off of both of those. Well, the only way to do that is to learn how to fix my body like Crystal learned how to fix hers. And so that's what I'm trying to do. So today's conversation will affect a lot of you guys out there. I know it will. And so, Dr. Hollis, we're going to start off with you explaining the differences between 1, 2, and 3 diabetes, the type 1, type 2, and type 3 diabetes.
Yes, and let me add to something you just said.
Okay.
Even the people that are not experiencing it now, even if they're not listening because they have troubles now, it will affect almost every American at some point before they die.
Mm-hmm.
It's somewhere around 86% at some point in your lifetime. So there's a couple, 3 biggest points I want to make sure we get through, but we probably will end up with a 2-part segment. But the biggest confusion that I get with people off the street is that they don't understand that there are type 1, type 2, and type 3 diabetics. And the old days, the older generations understand those terms differently than they are now, which causes even more confusion.
Mm.
So to cover all the bases, here's how I explain it to all of my patients.
Okay.
In the old days, there was what's called juvenile onset diabetes.
I've heard of that.
That is an autoimmune injury to your body that occurs as a child. It is not something that you're usually born with. It is an acquired condition, usually rears its ugly head somewhere between age 7 and 10. And it is now known through science to be a direct result of an adverse reaction to childhood vaccinations, which kill the islet cells of Langerhans that exist in your pancreas, also known as the beta cells. And then you stop producing insulin, which is the hormone that regulates and transports sugar, also known as glucose, throughout your whole body to every cell in your body. Now, the important part of that is they call that type 1 diabetes now. And for the general purposes of this discussion, it is not medically considered to be reversible, treatable, or preventable. However, every person that I believe seeks out natural health care can get improvement, even if we can't reverse it.
Correct.
Now, type 2 diabetes, as it's currently called, used to be called adult onset diabetes. However,
Not anymore.
now we have young children
That's right.
who are being diagnosed with type 2, and we have adults that are even as old as 50 who are getting diagnosed with type 1.
Yep.
So it is now something that affects every human, especially every American. And I'm sorry to say that, but that is the truth. And even though we may have the greatest healthcare system in the country, in this country for the whole planet, I believe we have some of the sickest and most unhealthy people on the planet. A little fun fact, they rate all 300 and some odd countries every year on how healthy they are. Do you know that we always rank below the number 50th country? And countries like Mongolia are ranked higher than us.
Wow.
So, sorry about that. That was a tangent. But type 2 diabetics are what most people will expect, which is also an acquired condition. I am a firm believer in my wellness clinic that if you weren't truly born with it, if it's not a congenital disease, if you acquire something, you can probably reverse it. So when a type 2 diabetic becomes worse and worse and worse, especially if they don't catch it, treat it, and take care of themselves, they will then become what is now called type 3 diabetes, or better known as insulin dependent type 2 diabetes. So that means you now have to have insulin injections or an insulin pump just to stay alive.
I just want to chime in real quick, because on to type 3 diabetes, what a lot of people don't understand, Alzheimer's and dementia are very highly related to that. So we need to control our blood sugar for sure, so we don't get that type 3 diabetes, because I know so many people, so many clients and friends of families that they're now dealing with Alzheimer's and stuff, and it's because of the type 3 diabetes.
Well, what we have to do is take care of our liver and our pancreas.
Right.
We're not doing that as a country. We don't understand how important those two organs are. They're as, if not more important than your heart. The reason why I say that is because when we abuse those two by eating high carb diets, such as donuts,
sugar, any sugar,
bread.
Yes, everything I'm trying to say here. And I mean all of that high carbohydrate diets are killing our internal organs, and those are the two main ones.
Right.
Those two main ones affect our heart, you guys. They affect our heart, and we don't realize that. And so when you stop abusing those two organs, then your heart is going to be better. Okay.
And
so
most people, sorry.
Go ahead.
I was just going to say most people don't understand the heart is often considered an inert organ. It does not have the metabolic functions, nor does it produce hormones or anything like these other organs. And almost all heart conditions are secondary to something else.
Which is my point exactly. That's 100% what I was saying. If you're not taking care of your pancreas and your liver and your kidneys, I'm going to throw those in there. Your heart is going to feel it. And that's the secondary he's talking about. The heart attacks, the murmur, those things like that are coming from that. Now, let me also say, we don't realize by eating the high carbohydrate diets that we're eating, that it's literally causing cirrhosis of the liver. And I thought that that was only when you drink too much. I did not know that there was a food-induced cirrhosis of the liver.
Non-alcoholic fatty liver disease. Yep.
Exactly. 100%. So you guys, that is diminishing the function of the liver tremendously. And the function of the liver are over 500 of functions that are within the body that we need that liver. Okay, so Crystal, you were about to say something. Go ahead.
Oh,
about the heart.
Oh, no, I was just going to say that, you know, you said the pancreas and we have to protect our pancreas. I don't know if everyone understands this, but your pancreas is what produces the insulin hormone. So that's why we really have to take care of it. And we're going to dissect this and everything, but to really be as simple and basic and just say, hey, this is the actual issue, it's sugar. Sugar is the issue. We all eat way too much sugar.
And there are over 500 different words for sugar. I mean, high glucose, corn syrup, all of these are, I mean, just look up the different ways that they put sugar in our food, and you'll see that sugar, alcohol, all of that, you guys, is a derivative of sugar. And so you have to be really savvy when you're looking at the back of labels, because they can say something else when they really mean sugar. All of it is really bad.
We can talk for an hour about labels.
Right.
And we probably will, in all honesty. We need to do that because people need to understand what those what they actually, if you have to read a label, don't eat it.
Right.
Yeah. If it's not a plant that comes from the ground, if it's made in a plant, we shouldn't eat it. If it comes from the ground, we should eat it.
Exactly.
Plant that comes from the ground.
I like that.
Yeah.
So just stick to more whole foods. It's a basic. You get an avocado. What's the ingredient in an avocado? Oh, avocado. Here I am.
Yeah. If it's only one ingredient, you need to eat it. Other than that, you need to let it go. But diabetes is killing us, you guys. It's killing us slowly. It affects your eyes. It affects your kidneys. It affects your inflammation in your body. And I have found out and figured out that I am insulin resistant.
Yep.
Had I known I was insulin resistant years before I was a diabetic, I could have warded off being a diabetic.
Oh, yeah. Can I add something to what you just said?
Yes.
People actually have insulin resistance 20 years usually before they're diagnosed with diabetes, by the way.
Yes.
Right.
And had I known, and there were plenty of signs, but I didn't find out about insulin resistance until the last year. And I'm 60.
And you can, and you know, we're going to talk about that. We can reverse that because if we stop the sugar
I'm in the process of doing that right now.
Yeah.
I'm in the process
Kathy's
of
doing a great job too of it. She's able to take sometimes not the full dosage of her medications. I mean, come on now.
And I stayed my blood sugar levels have been 6. It went from 13 to 6, you guys, and it did not rise after that. So now I just called my my family physician and told him I want to take my blood insulin levels and my glucose levels every 3 months for the next year. I want to see how this is happening within my body. I feel it already, you guys. I've been doing it for maybe 3 weeks, and I already feel my belly fat leaving. Okay, so these are the reasons why I know that I'm insulin resistant. I have a huge belly. So did my father, so did my grandmother. So I figured, okay, that's what I'm supposed to do. My brothers now have it too. So I look like my grandma. I have fatty arms. That's another insulin resistant symptom. I also have fat between my ankle and my Achilles heel. My whole ankle isn't fat. It's just fat between that area. That's also an indication of insulin resistance. I saw that years before I was diabetic and didn't know. It didn't make sense to me to have anything there. Like, why am I gaining weight right there? Had I known, I could have warded off a lot of being able to take medicines. And I hate taking medicines. So those were some of the symptoms that I'm dealing with. They are leaving because my belly is going down. In 3 weeks, it's going down. But anyway.
And what have you been doing for 3 weeks?
And I have actually been doing intermittent fasting. And that's when I'm telling you, I'm taking care of my pancreas because it's not spilling a lot of insulin into my bloodstream, which is causing the resistance for insulin. It's like a double-edged sword. You need insulin, but then I have too much of it. Let me tell you why I was having too much of it. I was eating, people were telling me to eat 6 times a day. I can't do that. I'm an insulin resistant person. So for my pancreas to be spilling out, spiking, not having a chance to rest, I was just burning out my poor pancreas. So by doing the intermittent fasting, I'm letting it rest, which means it's not spilling insulin out into my bloodstream, which means my belly fat is leaving because the fat cells are now able to, oh my goodness. So I got to just say this. Dr. Hollis, Crystal knows this. I've been trying to lose weight for a million years. I stopped eating bread. I stopped eating pastas. I stopped eating sugar. I stopped eating all dairy except for butter. I stopped eating. I took so much out of my diet and I did not lose the weight that I thought I was going to lose in the time that I thought I was going to lose. And in all honesty, I thought 30 pounds was going to fall off in a short amount of time, and it didn't. I'm like, what's wrong with me? Literally, I was like, what's wrong with me? Something's wrong. Something's not happening. What was happening was, although I took all that out, I was snacking. And Dr. Hollis, you said something that made me think extra hard to not eat after 10. And I was eating sunflower seeds up until I went to sleep, which was 1, 2, 3 o'clock in the morning, because I love sunflower seeds and they're healthy. So
they are at the right time.
There are, if you don't overindulge like I did, but I didn't think it was a big deal. It was just sunflower seeds. Wasn't ice cream.
Good.
Well, what was happening was, you guys, it matters zero what you put in your mouth, because your pancreas is going to spike insulin. Doesn't matter what you put in your mouth when it comes to eating. Your insulin is going to spike. So although they were healthy nuts, raisins, whatever, although they were healthy pecans, it didn't matter. My insulin was never at a level of rest. And that's why I couldn't lose weight.
That's interesting.
That's 100% why I couldn't lose weight. And now that I know that, I'm paying attention to my pancreas. Also, you guys, I want you to do an experiment. I want you to take your blood sugar levels, and then right under your right rib cage, I want you to massage that area, because that's where your pancreas is. And then take your blood sugar level again and see if they go down.
That's interesting too. I've never heard that, actually.
Yep.
Me neither.
I'm learning.
So you're massaging your pancreas.
Yes.
Hmm.
And on the other side, or on your left side is your pancreas, on your right side is your gallbladder. And
Bladder,
you do
liver,
the
yeah.
same thing on the gallbladder and liver area. And I tell you what, it relieves my pain. When I
Hmm.
had it over there, when I had that sludgy pain, I
Hmm.
would massage that area all the time and it relieved it. Literally relieved it. So you can massage your organs
Yep.
and they can perform for you better. We can also put essential oils on those areas as well to
Absolutely.
stimulate things. And
Or
you guys,
calm
as soon
things.
as it touch your skin, it's going to go straight through to that organ and do what it needs to do. So yeah,
Absolutely. Yep, I like applying essential oils. Like you said, it can either stimulate or it can actually calm, depending on which essential oil you're using.
yeah.
And when essential oils hit the blood, when they hit the skin, they're actually in your bloodstream within 1 to 3 seconds.
Yeah.
So that's actually goes with everything. So just understand that when you're in your water, like in the shower, you're using your shampoo, your conditioner, you're lathering with soap. All of those things are going into your bloodstream. So that's also why we talk about, think about what you're actually using, what you're putting on your body, having clean water, because heavy metals could be in there, chemicals, different things, and chlorine, for instance, that makes the blood sticky where it's not flowable,
Fluoride.
So
Fluoride is very detrimental.
and
Fluoride is very detrimental.
yeah, and so it's really important what we put on our skin, because it goes directly to the bloodstream. And especially if we put it on that affected area, like as Kathy was saying, when we use our essential oils, going right to the affected area is going to get it there faster.
Yeah. And I do want you guys to know that I have partnered with a person who will allow me to sell his water systems again. So if you are needing a water system, please let me know, because we talk about the heavy metals in water all the time.
Yep.
I have a solution for you. I have always had solutions for you.
Yep.
Please know, I have 3 companies that I know I can sell water systems through. So please know that I'll come out and test your water, specifically though, for you, make sure you don't have COVID, and test your water for you, and definitely get a system in there for you, because it's needed. It's so needed, you guys.
Mhm.
But that's on a whole nother tangent.
That's a third talk. They put COVID in the water.
Well, COVID is in the water because it's waste. It literally is a waste that causes all of that to happen. And there's no way that the water plants can get all that stuff out, you guys. It's just no way.
Medications, antibiotics.
There's so much in our water.
That's
That is
why
a whole
I
nother
only
thing.
use RO water.
Yep.
Throughout your
RO
home?
water or alkaline, either one. They're both.
No, throughout your home?
Oh, yes.
Okay. Well, yeah. Well, then you got a real big system then. Your system's nice.
Yes.
Yeah.
Whole house.
Whew. Yeah.
That's a good one.
So we can hold a whole nother system on that, but a whole nother conversation on that one. But I tell you what, diabetes is an epidemic. It's a bigger epidemic than COVID.
I believe
It's
10
even
years
a
ago.
bigger epidemic than cancer, you guys.
It is. It is. I believe like 10 years
And
ago,
it's a precursor. It's a precursor to cancer.
Yeah.
By the way.
Right.
Well, cirrhosis turns into cancer. So you get diabetes, then you get cirrhosis, and then you get cancer, or it just all happens fast. It depends on how fast you're allowing your cells to be damaged with your sugar.
But who tells people that? Who tells people that diabetes can lead into cancer? I've never heard that before until I started doing real research. So, Dr. Hollis, how does it turn into cancer? What's happening in our bodies to make that happen?
Most importantly, it overworks the cells and the tissues of the organs, which then cause them to try to reach mitosis and replicate too soon for the wrong reason, which is the definition of cancer cells. Cancer cells are always your normal regular cells that start to misbehave because they are overworked, overtaxed, or they're overtoxified. And in the case of the liver and pancreas, liver cancer, pancreatic cancer, pancreatitis, even for that matter, those are abnormal cellular reactions to the environment that they're put in. Now, the most important thing of all is that a lot of people don't understand what the definition of diabetes is.
Okay.
One of the ways that I like to simplify it, diabetes mellitus is a cellular membrane disease. At the cellular level, it actually has nothing to do with blood sugar. We simply discuss blood sugar all the time because it is an easy thing to watch and monitor, especially with lab work, because it is the most common secondary effect of the diabetes to end up with what we call hyperglycemia, high blood sugar. But you have to understand that is a secondary side effect of the main disease. So when the cell membrane becomes immovable, dried up due to dehydration,
Oxidative stress.
yes, overused and overstimulated by a surplus of insulin because the insulin is high because you've been eating too much sugar or carbohydrates or starches, which is all basically the same thing in different forms. Then the insulin resistance is the actual name for diabetes mellitus, just at an earlier stage, 10, 15, or 20 years before we call it diabetes.
So
Mhm.
mad.
You
I'm
have
so
to
mad.
remember, it's just like pain. Before you feel a pain signal in your head, you've already suffered cellular death at the site of the pain.
Yeah.
Those cells don't release the signal that you interpret as pain unless the destruction has already occurred of at least one cell.
Mm.
So, for you to understand that the side effects of diabetes are retinopathy and neuropathy and amputations of your toes and feet, that is a late stage death of the cellular tissue. Diabetes starts long before that, and it is detectable long before that, and it is treatable and reversible, in my opinion, with natural means sooner and more effectively than any pharmaceutical or drug can do, or any type of medical intervention.
So let
So,
me say something real quickly. Insulin resistance can be monitored in your blood. So it has to be
correct,
fasting. There's a fasting blood test.
correct.
And it will show up years, like we just said, before the diabetes. So you
Mhm.
Within
have
a,
to actually ask for that test, which is why I asked my doctor to do that for the next year. I just had my blood test done. He did not
Mhm.
do an insulin resistant one though. That's okay. I have it from a year ago, but I will have it from this point forward. Um, it can show up years before, which is why I'm so upset that that's not a normal test.
well
Why
said,
isn't it?
well said. It should not just be routine, it should be on every annual checkup and everything, even for children.
Yeah,
One of the other
100,
things I want to say
100.
really quickly, we
Yeah,
talk about blood work and we talk about tests and we talk about the reference ranges that are considered to be acceptable high end or low end. I will have a whole hour long conversation about how you really shouldn't pay attention to those printed reference ranges on your blood work. But on the test that Kathy is talking about, the main test is called a hemoglobin A1C.
Mhm.
And that is a 3 or 4 month average of all of your highs and lows of your blood sugar.
Correct.
And here's what I teach people before I even give them their results. The entire test has a range of only 1% out of 100%. That is the body's preferred functional healthy range. And if you deviate more than 0.1% in either direction, you are not regulating your sugar properly. And you can detect that very early on blood tests.
Mhm.
The other thing that I teach people is the older, less accurate blood test is called a fasting blood sugar test.
Mhm.
And that is a snapshot Polaroid of what the blood was the minute that they drag it out of your arm. It's not a 3-month average, but the normal range is 70 to 90. It is never supposed to go above 90 fasting, ever.
Mm.
After you get past 4 hours after your last meal, especially if you have fasted all night, it should never be above 90. So when you get to the 100 and the 110, you already know you have insulin resistance and what they call pre-diabetes. We don't use that term in my clinic. It is diabetes. It is insulin resistance. It's just the early stages. You shouldn't let people wait longer to think that they're still avoiding a disease when they already have the disease.
Yeah.
But when you hit 120 fasting, nowadays people think, well, that's an okay number. It is not. It is 50% higher than it should be ever. And if you get any higher than that, you are going towards type 3 diabetes, which is where we said your pancreas can give up and you can become dependent on external insulin just to stay alive.
Yep.
And
It's
that's
true.
what I'm trying to avoid right now, which is why I'm trying to take care of my pancreas right now. I know that I can reverse this thing. I've been trying to reverse it actually. And now I see results in me doing that. Go ahead, Crystal.
Go ahead.
Oh, I was just gonna say I can start pulling up the slides. They're not in any specific order. I just want to let everybody know that.
Not yet.
Okay.
Because I want to go into obesity and why
Ooh.
And
We're gonna
that's where
need-
something called diabesity comes in, because people think it's two separate things and it's really not.
it's
Because
not,
obesity
guys.
happens
It's
because of
all the one-
diabetes.
Yeah, exactly. That's exactly what I was trying to get at. 100%. Okay, now you can get in the slides.
All right. So it says eye, brain, heart health, and more. So, we talk about antioxidants and, we need those for so many things because as we were talking about oxidative stress. Think about it. Your cells need oxygen and antioxidants help bring that oxygen there. So it's gonna help counteract that oxidative stress and all those toxins that come at us every single day. So I just wanted to show you that, for instance, there's blueberries, blackberries, all the berries, they are high. When you eat berries, they're high in antioxidants, okay? And we always want to choose organic, of course. High antioxidants help us, with healthy brain health, for our brain. And, I just want to read this one part. I'm not going to read this whole thing because obviously you can see it. But the strongest antioxidants due to free radical scavenging abilities, 2 different pathways. Oxidative cell damage has been linked to numerous diseases such as osteoporosis, type 2 diabetes, and cancer. So we're talking about type 2 diabetes today. We're talking about, cirrhosis of the liver. We're talking about cancer. All of these lead in to major factors in our health. And when we start working on, we don't have to take a bunch of different things always to correct these issues, but we do need antioxidants. A lot of us are just eating sugar and carbs all the time, and we're eating out all the time. We're eating processed foods, and there's no antioxidants in these foods. So I just want to let you know that look at your plant foods, your dark reds, your dark blues, your dark greens. All of those have great antioxidants in them. And something that is really good for blood sugar support. Organic aloe vera and cinnamon help support balanced blood sugar glucose levels. Now, I'm not talking about cinnamon that you can just go buy from the grocery store and put it into your pancakes or something. I'm not talking about that. I'm talking about you have to have the cinnamon with the right amount of compounds in it. It has to be a right percentage. So we have to get medicinal cinnamon, and it's grown in different areas of the world. We have to know that different herbs are grown in different places of the world. Wild crafted is always best because there's usually no chemicals. It's organic. They're out there in the wild where nothing has touched them.
And if you want to put on the screen real quick, I'll show you the one that I have. It's called, okay, is it backwards?
Ceylon cinnamon powder. No, it's not backwards.
Okay.
Or how do you say that? Ceylon?
Saline or Cylon, you guys. If this is the one that you want, you don't just want, like she just said, you don't want the one that you can just put on your food. You want this one. It is, I think it comes from Sri Lanka. Yes, it's raw from Sri Lanka and it's organic.
Awesome. Awesome.
Okay. Thank
All
you.
right. Yeah.
I'm glad you said that.
Yeah. And then also I want to talk about aloe, because aloe is like, it's actually beneficial for more than just blood sugar support, but aloe is beneficial for both insulin dependent and non-insulin dependent diabetes. So that means type 1 and type 2.
Yeah.
Here we are. Let me just pull this up real fast. I can't even read number 1, but I know that aloe is able to stimulate the secretion of the hormone insulin in the body, thus regulating our blood sugar levels. 2, aloe vera detoxifies the body, thus getting rid of excess sugar from the bloodstream. That's great because a lot of us eat too much sugar as it is. It contains proteins that bind carbs together, so it has a slower digestion process. The slower we digest, that means it's slowly releasing the carbs. It's slowly releasing the sugar, so it's not all at once, so that our insulin doesn't spike all at once. These compounds help in lowering the presence of sugar in the blood and to help maintain correctly afterwards. So that's kind of what I just said, I guess. Traditionally, the juice from this dark plant is used as a natural remedy that helps lower cholesterol and blood glucose. So just know that aloe can do for both things. So if you have something with like high cholesterol, maybe your HDL is low and your LDL is high, aloe vera is very good for that. Aloe vera comes with anti-inflammatory properties. These properties help protect from different problems like infections, ulcers, and wounds. So this is also great for your digestive system as well. This is aloe vera is something that whole leaf aloe vera, actually, I used to take when I had ulcerative colitis, because a lot of times your stomach feels like it's burning or it's on fire, and I just say aloe vera, it's there to put out the fire, basically. And then 6, it is said that aloe vera can lower blood glucose significantly in a few months. So just understand that we always teach your body cannot heal in under 3 months. And then you add on a month for every year you've had the issue. So if you've had diabetes for 10 years, we're going to add 10 months to those 3 months. So 13 months altogether, we should be taking aloe vera. So to fully get to the root cause. So just in a few months, that's why I say just in a few months, because the body doesn't heal in under 3 months. It takes at least 3 months to start getting that healing to start. But we do want to continue it depending on how long we've had the issue. And then the gel is the plant is abundant in glucosamine. I think I said that right. Glucomannan, thank you. Glucomannan is a dietary fiber. It's easily dissolved in water and helps lower the amount of sugar found in the body. So that's really good.
And let me just say that the high cholesterol is a direct derivative of diabetes.
Right.
It is. It goes hand in hand. A lot of the times, even the herbs we take can help multiple things. Like if you have diabetes, if you have high cholesterol, and if you have high blood pressure, most of the time we're going to give you the same herbs for those things because they all are very much closely related.
Mm-hmm. And don't forget your bitter herbs. Bitter herbs are very important.
And I'm going to say something about the digestive system too, because bitter herbs are great for that digestive system. We have to digest our sugars. We have to digest the fibers, the carbs, the proteins, the fats, all that.
Which is why we got to take care of our liver, you guys, because our liver, the absorption of sugar is through our liver.
Right.
And that's why there's the cirrhosis of the liver. That's why it's so bombarded. It's so overwrought with what we're giving it every day, which is the other reason why I want to get off of my meds, because I know my liver is being affected every time I take a med.
Right.
And I just don't want to do that to my liver anymore. So I'm paying attention to the inside of my body, which is then going to make my outside look what it needs to look like.
Right.
And I just have to say, you guys, the more that we do things to our bodies on the inside, it will show up. Like I can just tell you, I know that I've told you about these things on my face. Everybody thinks they're freckles. They are not. These are skin tags. These skin tags have happened because my liver was already damaged and Kathy didn't know it. So I was probably having these 30 years prior to, I just got diagnosed with diabetes. Well, I guess I don't know. I can't remember. I was 50 something. But these showed up long time ago. And I didn't know what they were. I didn't know why they were there. I have skin tags, literal skin tags that showed up long time ago. I didn't know why. It's because my liver was trying to tell me I need help.
A lot
It
of
showed up
times,
on my skin and I didn't know it.
exactly. A lot of times we can, when we improve the liver, like you're saying, we also can improve the thyroid as well. And the thyroid controls our metabolism, which also helps control the sugar as well. And our weight loss. And like how we were talking about obesity, you have to understand that the thyroid controls that. So if you help most of the time when we help the liver, we help the thyroid.
And I'm obese. I mean, I am. That is something that I have been for a while, and I used to blame it on my kids. It's not their fault.
We
I
blame
used
it
to
on
blame
them.
on them, but right after I had Alana, I was size 14. I mean, and that was 35 years ago. That wasn't an obese person. I look back at those pictures and I thought I was huge because I was 120 all the way up until I got 20 pounds, 120 pounds all the way up until I got married. Then I got pregnant and then I went up to a size 14. Oh my God, that's horrible. It wasn't. That's what I'm trying to get back down to, actually. It's a full thing. So, yeah, I mean,
You can
I'm
do
just
it.
saying.
You can do it. You're going to do it.
Oh, I'm there. I'm there already. But Dr. Hollis, what is happening to my liver that's caused, or people's liver that causes these and causes the skin tags that we think are just stuff that happens on our skin?
So back real quick to one other paragraph. The liver also is responsible for manufacturing the cholesterols in our body. And that is part of the reparative process of every other cell in your body, including your liver. And what a lot of people don't understand is that the liver produces enzymes that go out through the blood that repair other damaged tissues. And the sugar is damaging your tissues, including your skin. And the liver has to spend its time repairing everything else before it has time to repair itself. And often it will sacrifice itself, just like a good mommy would do, to take care of all the other children before it takes care of itself.
Yes.
And then it still doesn't ever get a chance to catch up on taking care of itself, which is why the skin tags are usually on your extremities or your creases, like the creases around the neck or on the back of the neck, because that's where the blood sugar gets stagnant. Blood flow, it builds up the sugar and the skin reacts because the toxicity of the sugar. Sugar is very acidic, and that's why alkaline water is so important, because the sugar acidity is what damages the nerves of your eyes and your hands and your feet. And remember, your head is considered an extremity from your core thorax of your body. So you'll lose this and you'll lose your toes and you'll lose things up here before you lose your organs, because your body will try to keep your organs alive, because you only live as long as your weakest organ. But while your liver is trying to keep the rest of you alive, it's getting damaged and then it will die. And then when they diagnose you of dying of natural causes, it's almost always liver failure or kidney failure.
That's true.
Because you couldn't keep them going long enough to actually repair all of the toxic load damage in your body.
And basically your body becomes acidosis. You're full of acid.
Right. And if you're not careful with the sugar, you can get ketoacidosis, which is very dangerous. So anybody who's doing fasting or keto or Atkins or anything else like that needs to be monitored by a physician to make sure they don't go all the way into ketoacidosis.
Yeah, and tell me what is ketoacid? Like, what's the difference between keto and ketoacidosis?
Well, keto stands for the formation of ketones. Ketones is when you break down the fat you already have stored and you're metabolizing protein and fat instead of carbs. So it is literally all of the low carb diets are ketone diets. But people tend to take it too far and too fast, And if you develop too much ketones in your blood, you will get what's called ketosis, which then, if that's not treated, and it's somewhat okay to hang out in ketosis for a little bit at a time to help you with the weight loss and the fat metabolism and defeating the insulin resistance. But if it's not monitored safely, your ketosis will become ketoacidosis, which can kill you in a short amount of time. So I tell everyone to be extra careful with these dietary changes and lifestyle changes. They should be monitored by a natural healthcare professional.
So what is ketoacidosis? I still don't know what ketoacidosis is.
The buildup of ketones in your blood to a dangerous acidic level.
Okay, that's what I want to know. Okay, that's okay.
and just make sure you do your research too, because on certain diets like that, we want to stay safe, because it does say to take extra minerals like your electrolytes and different things, vitamin D,
Right.
et cetera. And
Water.
just, drink your water, of course, but just know that your minerals are alkalizing. Those are what we need for all of our things to function in our body, like magnesium for nerves and colon, the brain health. It does so many different things, and so many of us lack magnesium. And the reason we lack all these minerals really is because we're not eating plants, real food.
Right.
We're eating stuff made from a factory in a plant, not on a plant from the ground. So we just need
if we ate as many plants as we needed to eat, we'd be eating a plant full of plants. So
that's why we take herbs, because they're a lot more powerful. They have a lot more minerals in them. You can take them in a small amount, like little capsule or a liquid extract. They're really strong that way, so we don't have to eat all these hundreds of different things of big bowls of food.
Right.
So yeah.
And we have, you guys, this is what I want to tell you. We have all these solutions.
Right.
There's not anything that we sit here and tell you where we cannot give you a solution. We have people that have natural soaps where you don't have to have chemicals on your soaps. We have people that will guide you, lead you, and direct you, like Dr. Hollis here. Please call on us to call him to get you connected with him. Definitely, he will guide you, direct you, and lead you in the right direction. Go ahead.
You don't have to do it on your own. And you don't have to listen to your neighbor or your mom or your dad or the internet or Google. Call us, and most of the time it's free. Just call us and let us help you. Because if we can help you, we can help even more people.
That's right. So we don't give you gloom and doom. We're giving you solutions at the same time. I just know that when you're serious about your health, you will be able to reverse, I would say 98% of what you're ailing, like arthritis.
That's a simple fix too, by the way, that people don't know.
And diabetes go hand in hand. Who knew? I didn't find that out until I started doing my research.
The inflammation is the key.
Inflammation. Exactly.
We have to decrease inflammation in order to heal, repair, reset, all those things.
And when you get rid of all that sugar and acidity in your body, your pain is going to go away. Go ahead, doctor.
I tell people, how much trouble is it to have a severely sprained ankle? It can literally grind your life to a halt. You can't get dressed, you can't drive, you can't shower, you can't work. But if you have 13 organs and you have all 13 of them with a sprained ankle all the time, because that's the inflammation level that you're at, that's what you're walking around with every day. And they don't just recover automatically. So, yeah, I like to tell people that.
Food is medicine. We got to repair it with food. We got to repair it with our mental health, our emotional health. We got to repair it,
spiritually, all of that.
Everything.
Spiritually is a big one. Yeah.
We treat spiritual, emotional, mental, and physical health care in our clinic.
That's right.
Including counseling and everything, stress management.
Yeah.
But yeah, that's what holistic healthcare is all about. And thank you for the kudos, Kathy. I do my very best for everyone.
Yeah, it's just needed, you guys, and we need to find people like us in your lives, because We don't want you to suffer, just like God didn't want you to suffer. He's not.
Right.
It's just not.
God doesn't want you to be in pain and suffer and shorten your life. You're supposed to be here to witness to other people. You don't want to shorten your life. What is it you girls say?
Too.
If you're green, you're clean.
Yep. If you're green inside, you're clean inside.
That's right.
Yeah.
And health is wealth. Because without your health, you can't do anything with that. So, and saying that, we're about 4 minutes to where we have to get off of here. But Dr. Hollis, is there anything else you want to say? We're going to have to, this is going to be a part 2 the next month that you come on, because we're not even done. We're not even close to being done.
Yeah.
I want to stress the fact that the light at the end of the tunnel is always bigger than you think it is. Even if you've gotten a bad diagnosis, at the end of the scale, we can help bring you back. Even if you only suspect there's a small problem and you're at the beginning of that scale, we can help you bring that back.
Prevention.
And as Crystal said, possibly oversimplified, it's not that hard to fix. But this is a participation sport. It's a two-way street. What I tell people is you have to help me help you. I don't do it to you. I help lead you. You have to be motivated, dedicated, determined, and ready to make some changes so that we can help you reverse it.
There is a simple way to get, and a lot of people, I just want to say this one last thing too. People have a ton of addictions. They think they're addicted to sugar. They think they're addicted to, you actually are. You're addicted. And guess what? There is a diet. There's a thing you can do where you quit certain foods and things where you can eliminate all those cravings, all those addictions within about 3 days, to be honest, if you really did it.
And you won't even miss it when it's gone. And your food would taste better once it's gone. That's the huge thing right there. Everything tastes better because the sugar is not dulling the senses. And so when you heal your liver, you guys, you won't be before every commercial was about food and I wanted everything that was on the TV. Now that I'm healing my liver, I don't care that a big hamburger with cheese dripping down it. I don't have to run over to the hamburger place and grab one because I don't crave it anymore. Your cravings literally go away. You know, they literally do. I don't believe in. Go ahead.
No,
I was going to say, I don't believe in cheat days because cheat days open up a door to it getting bigger. So if you're doing this, be like Dr. Hollis said, be focused, laser focused on getting your health done. Just know that you're not going to be cheating any kind of way because it will open up a door to want more and more and more. And then you go back into the bad habits, which is what I've done all my life. And I'm trying to tell you not to do that. So go ahead, Dr. Hollis.
Did you know that the same center in your brain that's part of the limbic system that responds to all addictive chemicals, including heroin and cocaine and tobacco and nicotine and alcohol, is the same one that sugar activates?
Yes.
Mm-hmm.
It's as hard of an addiction to kick as any of those other ones that I mentioned. So if you have a cheat, if you fall off the bandwagon and you're a patient in my clinic, we inform you that we have to start your 90-day clock over again.
Oh my.
And once somebody does that a couple of times, they usually will stop. So thank you very much for having me. Crystal, you get the last 10 seconds.
Oh, no worries. Go ahead, Kathy. You can wrap it up for us as usual.
Oh, yeah. You guys, we threw a lot of information to you. We know we did. We want to do that. We want to get your mind thinking because we need you to get healthy. And in order to do that, you have to know. Once you know, you can't not know.
Right.
Once you know, you can't not know. And now
once you're healthy, you can't go back.
You wouldn't want to go back.
You don't want to go back. You don't want to.
You wouldn't want to go back.
That's what I meant.
Yeah. I have no interest in gluten.
The 3 of us are here to help you guys. The 3 of us will be here the same time next month. Well, we're here every Wednesday. Crystal and I are. But Dr. Hollis will be with us again next month. Oh, please, please, please join us because we're going to continue this conversation. We'll give you more better tips. There are more slides for us to go through. just know that you're not alone, like Dr. Hollis said, and just know that health is wealth. And when you are green inside, you are clean inside. We'll see you
Yep.
next Wednesday. Bye, you guys. Thank you so much.
guys. You have a good
Thank you, Dr.
one.
Hollis. Thank you,
Thank you.
Crystal.
All right. Bye-bye.